Today, we shall be looking at management of facial paralysis, that is facial nerve palsy or facial nerve paralysis, with emphasis on rehabilitation. What is facial nerve palsy? Facial nerve palsy is basically the paralysis of the facial nerve. The facial nerve is the seventh cranial nerve or cranial nerve 7. That is the facial nerve. Then, when there is an affectation of this particular nerve, there is a transection, the lesion of this particular facial nerve, it can lead to paralysis of the muscles it supplies. Generally speaking, the facial nerve supplies the muscles of the face. So it comes out of the stylomyostoid foramen, that is here, then gives out 5 branches. This is not intended to be like a medical school or lecture for medical students, but it's just an overview. So when it comes out to the stylomyostoid foramen, it gives out 5 branches which supplies the face. But then that is not the focus. If anything happens to the facial nerve, the muscles that it supplies will be paralyzed. Now, for distinctive purposes, the facial nerve palsy can be categorized into 2 forms. One is the facial nerve palsy. Secondly, we have the Bell's palsy. Then the facial nerve palsy is usually of upper motor neuron lesion. It is usually of upper motor neuron lesion type, meaning that it accompanies neurological conditions like stroke. Whenever you see somebody having stroke, some of them come down with facial deviation, facial asymmetry. You see the mouth dragging to one side, either right or left mouth deviation. For stroke patients, you understand that this is facial nerve palsy because it is of upper motor neuron lesion type. The other one we call Bell's palsy is still paralysis of the facial nerve, but then it is not of upper motor neuron lesion type, so it's lower motor, meaning that it does not accompany neurological conditions. It can just happen on its own. The patient doesn't have stroke or any other neurological condition, but there is mouth deviation. So generally, this Bell's palsy is usually referred to as idiopathic, or meaning that is of unknown cause, but recently its cause has been traced to certain predisposing factors like infections of the ear and other form of trauma. Anything that can irritate the facial nerve in the course of the facial nerve can cause this Bell's palsy. Then clinically speaking, they will use the clinical presentation to distinguish between the facial nerve palsy, which is the one of upper motor neuron lesion type, and the Bell's palsy, which is of lower motor neuron lesion type. So now, when you see a facial nerve palsy, you understand that it is usually the lower 1/4 of the face that is affected. The lower 1/4 of the face, that side of the face, it is not the entire half, but the lower 1/4, usually the bulk of the buccinator muscles that is usually paralyzed. But for Bell's palsy, the one that is of lower motor, it paralyzes the entire half of the face, meaning that it also, apart from the buccinator muscles, the muscles of the cheek, it also affects the frontalis muscles, the muscles that you use to wrinkle. This is one of the best way we distinguish facial nerve palsy, which is of upper motor neuron lesion type, and Bell's palsy, which is of lower motor neuron lesion type. If you divide the face into 2, the affected part, if it is Bell's palsy, the entire half of the face will be affected. So if it is facial nerve palsy, it's only the lower 1/4 of the face that will be affected. This is not intended to be an elaborate lecture as we normally have it in the medical school, but just for emphasis so we understand what we are dealing with. But then the management, like I said, I'll place more emphasis on rehabilitation. Of course, there are some procedures for medical management of the condition, including treatment of inflammatory changes and so on and so forth. Then for rehabilitation, we actually manage the weak muscles to the point that the weak muscles will be strengthened and the facial asymmetry will be no more. The face will maintain its symmetry. Then we do a lot of stimulation. After assessing, first of all, we look at what is wrong with the face. Then we check the face and check the actions of the muscles of the face, what the muscles can perform, what they cannot do. Then we look at each of the individual muscles and we do assessment and find out which one is strong and which one is weak. Then we measure also to find out the extent of deviation. Then we begin to stimulate using certain machine, electrical muscle stimulator, to be able to strengthen the weak muscles of the face. Then we also use exercises. We use exercises to build up different forms of exercises at dim fit to build up the muscle strength, to ensure that the muscles will begin to regain their actions. Then we also sometimes we also use other machines too. Maybe if there is irritation or whatever, or there's adhesion, or let's say adhesion or keloid tissues around the cause of the facial nerve, we can use ultrasound machine to be able to ensure that we send in ultrasonic energy in that place to be able to relieve the facial nerve, so that the muscles can also begin to act as they're supposed to act. Like I mentioned, we also use different forms of facial exercises. Then we can also use strapping to maintain, to keep the deviated muscles in place, to be able to check the balances. Because once there is a facial deviation, that means that the stronger muscle is pulling the other muscle. Why am I bringing this lecture here? I once had a patient somewhere in one interior place. I'm not going to mention the place, but then I saw a man who has Bell's palsy, but then this man was treating it as a spiritual problem, and he was going to a local place where they would do a manner of things for him to be healed. So a lot of people see people's faces that are deviated, and they don't know it's a medical condition that can be treated in the hospital, that can be treated and restored by physiotherapists. They think it's an attack. If you are listening to me, you are watching this video now, and you know somebody having this condition, tell the person that there is a solution. Remember, I've always said, the earlier you present to your healthcare provider, the better the prognosis, the better the expected chance of recovery. So if you have somebody having facial deviation, whether the person has stroke or not, there is a management protocol for it. We do it in the hospital. Then you can also consult individuals, and the person can also attend to you wherever you are. The message here is that facial paralysis leading to facial asymmetry can be corrected. We have handled a lot of cases like this at University of Port Harcourt Teaching Hospital, which is a 5-star hospital in Rivers State. We have managed a lot of cases like that here, and we have also seen the progress, the recovery of individuals like that. Thank you for listening to me. Stay tuned for more updates. God bless you.